So now we get a reverse response in the adrenals. A persisting, though, of adrenal upregulation will eventually lead to adrenal exhaustion. And this is what we call flatliners. These are the people that say, I get up and I feel tired. I eat something for breakfast, and by 10 a.m., I feel like I'm going to take a nap. By 12, I feel again, oh, I'm hungry, I got to eat. And by 2, I start to snooze again. I come home from school, or I come home from teaching, I come home from dance. 5 o'clock, I need to take a rest. I tell the kids, hey, just give me a minute. And it becomes a half an hour, make dinner. I can't wait to go to bed. Okay, anybody know? Don't raise your hands. Lots of people experience this, okay? And that's adrenal exhaustion. Now, when we see this type of an adrenal response, the blood sugar is one of the primary responses of cortisol to maintain. The adrenals also maintain immunity, immune function, okay? So they can't vote you off of the island. You have immunity, right? When we look at the immune system, the immune function, we're actually looking then for the body's appropriate response to what is actually an offending agent. Healthy adrenals then will actually keep us from developing more food sensitivities. Unhealthy adrenals lead to more allergies and more food sensitivities. All right? And we've seen that as we've done the book reviews. Go ahead.
Since the thymus is something that also works with that, do those two work in conjunction?
Okay, so the question is, does the thymus also work with that? Remember, the thymus is a butterfly-shaped organ in, or actually below the sternum. So let's say the sternum is here, and this thymus itself is basically gone by age 5. Okay? So the thymus only responds until about age 5, maybe up until age 10. But it is the T of T helper cells that are actually thymus-driven cells. So our immune system is actually created pre-adolescent. Okay? The thymus actually will shrink and shrivel until it's basically negligible and gone as we get into adolescence and by the time we're into adulthood. It's consistently actually shrinking. Okay? So the thymus, that T response, when we see T helper Th1 and T helper 2, we're referring to the natural killer cells, which is cell-to-cell communication on Th1. Th2 is the humoral or antibody response. That's the memory cells and the long-term potentiation. Those cells are actually matured and actually differentiated by the time we're about age 8. And then the thymus has been shrinking all along.
Okay. And it goes primarily back to the adrenals, is what you're saying.
That's right. So that's why the adrenals have such a big responsibility in this, okay? So a person with this elevated cortisol presentation like this will actually see then their blood sugars will become very dysfunctional, okay? They become very hypoglycemic or reactive hypoglycemic, or they may even be hyperglycemic at times. This person will start to develop multiple food sensitivities and multiple allergies. So the immune system gets confused when this cortisol level stays high, okay? Or when it drops way low also, because it doesn't have a normal rhythm. So my rest and repair phases are disrupted as well. The other thing that we'll see is, because cortisol is helping to maintain blood sugar, it also helps to maintain thyroid function. Elevations in cortisol inhibit T4 conversion to T3. Okay? So this becomes a big problem when we have cortisol imbalances as well. This also, when we look at immunity, has to do with gut immunity. And so when we see elevations in cortisol, we'll actually then see, as we maintain immune function, that we have GI health. But when we start to look at elevations of cortisol, we'll see thinning of the stomach lining, which then causes refluxing and heartburn. Okay? So a healthy GI system is maintained by optimal cortisol levels and adrenal health. And so then we start to see acid reflux, and again multiple food sensitivities, including then irritable bowel syndrome or leaky gut syndrome. Okay? So the adrenals have several major roles. And then the final is augmenting our hormonal levels and augmenting also our, so we go from hormone levels to then finally maintaining the function of our blood pressure. And this is accomplished by some of our aldosterone, which is a major hormone that resorbs sodium, potassium, and our other electrolytes, magnesium and calcium. Okay? So blood pressure is another one of these. So healthy adrenals, you can see, play many, many roles in the body. And when they're out of balance, you can see many systems that start to get out of balance, right? So when we look at perimenopausal symptoms, this is one of our major things that we need to maintain is adrenal health, right? Now, adrenals also, because of a healthy GI system, will also influence then our hormonal levels by the amount of cholesterol that we absorb. So essential fatty acid metabolism is a role that's linked to GI adrenal health, as is then liver function for producing then all of our neurotransmitters. Okay? Let's take a look then at a couple other things that lead to perimenopausal symptoms. Everybody okay to that point? Okay. I know this is an exciting topic for some and more of a fear, a dread for others. Jake is just feverishly taking notes. He wants to know all about it.
Oh, it's just the defensive mechanism more than anything else.
Please. Okay. When we look at perimenopausal symptoms then, when we start to see the body in an imbalance in the liver, we often will start to see a condition of estrogen dominance. Remember, we've talked before, estrogen dominance has several hallmark signs. One of the primary ones is blood clots with my period. And a lot of people will describe this as liver chunks. Okay? You'll know what I'm referring to if you have blood clots with your period. The next thing that we start to look at is uncontrolled bleeding. So the bleeding doesn't stop, which is most consistently associated with uterine fibroids. Okay? So estrogen dominance leads to uterine fibroids. The third thing that we see is breast tenderness the week before my period. And the final thing that we see is gallbladder dysfunction. So, what is the primary treatment for these two? And for this last one, let's see. So we have a hysterectomy to treat it, right? Or a cholecystectomy to treat the gallbladder dysfunction, right? Does anybody know anyone who's had a hysterectomy? Anybody know someone who's had a cholecystectomy or a gallbladder removed? Okay? Again, very, very treatable if we know what to look for. Okay? So this is a liver dysfunction where the estrogen is not inactivated. So we have this maintenance of elevated estrogen levels and estrogen dominant presentation, lengthening of the period, and then we start to see these things starting to show up. Please.
Do cysts also cause for the estrogen dominance?
Polycystic ovarian syndrome or ovarian cysts are not caused by the estrogen dominance. More commonly we'll see that with a metabolic syndrome that's going to be linked to one of the deal breakers that we've talked about before with adrenal fatigue. Okay? It may be a chemical imbalance, okay, meaning some type of a chemical sensitivity. It may be some type of a heavy metal toxicity, an infectious burden, or a blood sugar imbalance. Okay? Most polycystic ovarian syndrome is manifest, and that actually can be a perimenopausal symptom or a driver. But we'll see with PCOS a metabolic syndrome that is primarily linked to or manifest as testosterone dominance, So oftentimes, again, you'll see the female that starts to develop excessive hair on the arms, facial hair. Then it becomes insulin resistance. So a lot of times that person will be overweight. No matter what they do, how hard they exercise, there's no change in my body response. And so we'll see that also with the PCOS. Okay? And then the other thing that is very common is a presentation of infertility because now I don't have periods. So these are oftentimes the girls though that will have the 45 plus no period. Okay, 45 days no period plus. So I've seen several young ladies that will come in, they'll have no period for 3 months, and then as we work on their adrenals and their thyroid, this can be a thyroid dysfunction, lead to thyroid dysfunction also. When we treat the thyroid correctly, and primarily an autoimmune thyroid, we'll see that 90-day period cut in half to 45 days, and then to 28. And that's really exciting, okay? Because then they can actually have pregnancies again. Most of the time, this is treated, PCOS is treated with, for insulin resistance, diabetic medication. So glucophage, glyburide, glipizide, metformin, okay? And that's the way that they, the medical world, will primarily treat that. We want to look at this in a completely different way. We want to find what the primary driver of the PCOS is, and then find the links to healing the thyroid while we're healing the liver and then also the adrenals. All right? So from a functional point of view, again, we're looking at what has the dysfunction and restoring a normal function. All right? Please?
What is the specific, besides number 2, you've got fibroids. Are we talking about fibroids where?
Uterine fibroids.
Uterine fibroids.
Yep. So this is an example of a lady that came to us who had a uterine fibroid that measured 8 inches above her navel. Okay? She looked like she was in her second, almost her third trimester. The fibroid was so large. Okay? And treating that with some herbs, we were able to actually reduce that and get her bleeding to stop. That's pretty exciting. Okay? Avoided surgery in her case completely. And fortunately, in her case, I've seen some different people with different religious perspectives that have wanted to avoid surgeries and blood transfusions, and we've been able to help them considerably because that was their biggest fear. Okay? We've seen several cases where this type of uncontrolled bleeding, though, is linked to thyroid. Okay, remember when we read and reviewed the thyroid book by Dr. Karazian? That actually becomes one of those types of symptoms or syndromes. So thyroid health is also essential to our normal menstrual cycles and passing then into a menopausal phase. Okay? Please?
Yeah, is this a good place to ask a little bit more than about the liver? Is there
Absolutely.
is there any kind of a general, I know we all treat it a little different, but what can we do? What can we do with our diet? What can we do to clean up our liver?
So the question is, how can we optimize liver health?
Yes.
Okay. So liver is really, we talked about this on one of the videos we have online, is the night that we talked about glutathione. Remember the antioxidants? Glutathione is essential to liver health and wellness. Okay? What can we do though just in a dietary type of a thing to maintain liver function? One of the most important things that we can eat are beets. Okay? Remember, beets fall into the 4 C's of our adrenal health. It's the reds. Okay? So beets are very, very healthy to the liver. It actually helps to maintain the proper viscosity of the bile for elimination of bile fluids and bile salts. It also helps to maintain our hydrochloric acid concentrations. You've heard of betaine HCl. Betaine HCl is an extract of beets. So beet-based hydrochloric acid to be able to replace the levels of decreased or hypochlorhydria in the stomach. This is very important for the body. Okay? So beets, very, very helpful. Okay? What else can